Today we're just looking at some of the steps of doing a deep distal canine restoration. One of the things that's really important with any sort of restoration is that your tissue is completely anaesthetized, profoundly and in every particular position. And the reason why this is so important is because it's such a distraction. You have so little brain capacity available once you're distracted. If the patient is stressed or if you're focusing on the patient and their discomfort, you won't be focused on the procedure. So we're using a lot of anaesthetic on the buccal, but also on the palate side of the tooth to make sure that we can do anything we want to the tissue. And particularly with deep restorations, because you know that you are going to retract or damage that tissue. And you can see here I am using a wand. I don't really care how you give the anaesthetic. I like using a wand because it's less painful, but not many clinics have one. Basically inject slowly. I just find it's very precise with the way I can hold it in my fingers and the ability to give anaesthetic at a slow, consistent rate that is generally on the more comfortable end of the spectrum. In this particular case, many of my patients are also obviously sedated with IV sedation, or they've had anxiolysis with lorazepam, which obviously use your own state regulations to determine the correct amount. I want the patient relaxed. I don't want them to move. I want them to be like working on a model. So everything I can do to control that is going to be useful. Now, you can't always use a rubber dam straight up front with a deep restoration. In this case, I'm going to give it a try. One of the things that's really important to understand is it's totally fine to take your rubber dam off if you've put it on and then you decide it's not working for you. So, you know, if you try something and it doesn't work out and you've got to try something else, totally fine. Do it all the time. When you're early in your career, you tend to see this as a bit of a failure, like you should have known. Later in your career, you don't care. You just go, hey, I tried this thing and it didn't work. So here you can see I've put on a rubber dam, more teeth, so at least 2 teeth either side of the one I'm working on. So I've got a visual field, and you can see that I've just tried to floss the rubber dam down. Okay, the rubber dam is probably not going to go deep enough on that canine because the cavity is really subgingival. So you can see here that I'm trying to evert or fold over the rubber dam into the gingival sulcus, but in some areas it's not going to go. So I'm going to use a floss ligature. Now, I was taught to use floss ligatures from dental school. Excellent idea, but what you can see is that if you tighten this floss up, it's probably just going to disappear under the tissue, and it's not really going to hold the rubber dam down any more than it is. So you can see here, I'm putting the floss around the tooth, and I need to actually put tension on that floss. And you see there's a lot online, a lot of social media posts. You'll see that the floss are tied around the teeth and then they're pulled off somewhere, but most of the time you never see where they're pulled off to because that bit doesn't kind of look tidy. So first of all, I'm just going to get the floss around the tooth. It's a very simple knot. I won't show you how to do a ligature on this particular video. And then we push it down on the palate side using a flat plastic. You can use a cord packer as well if you want to, but it doesn't really do anything better. Okay, and you can see when I retract the floss up with tension, it holds the rubber dam way up out of the way, but as soon as I let go of it, the rubber dam comes back down over the cavity and it will get in the way. And what will happen is the rubber dam will get caught in our burrs, and then when you are cutting, the burr is going to get tangled in the rubber dam and it's going to cut the rubber dam, and then you might as well not have a rubber dam because blood's coming through. So we're trying to retract it enough, hold the tissues out of the way, and also protect the rubber dam so that it doesn't get a hole in it. Now, rubber dams leak all of the time. So the first and foremost idea of using a rubber dam is just to make your life easier. And if it's not making your life easier, then don't use it. So you can see here, I've got 2 ligatures on. I'm trying to decide if that's enough. And I've decided it's enough, but I'm also going to protect the rubber dam with a wedge. So I've tried this plastic wedge. You can see it's lubricated with glycerin. The glycerin stops it grabbing on the rubber dam and bunching it up. Now, sometimes the first wedge doesn't work. So I want you to notice how many times I try something and it doesn't really work, so then I just change quickly. I don't keep trying to get the same thing. It is easier with more experience because you have more methods for fixing a problem and you're used to trying a new thing quickly if the old thing doesn't work. What you didn't see there is I got that wooden wedge and I shaved it to make it go narrower so it would fit into that interproximal space. And so to get the rubber dam protected so it's not going to tear and I can prep really deep, I've done these 2 ligatures and used a wooden wedge that's been shaved down with a scalpel so it will fit into that small interproximal space. And that's why you need to have anaesthetic on both the buccal and the palate, because to push that wedge in, you have to traumatise the tissues quite a bit. The ends of the floss are wrapped around the rubber dam frame and either tied in a knot, or if you can't tie it in a knot because the rubber dam frame is in the way, you wrap it round and round and round enough times, and then you put a drop of either bond or flowable on it and you cure it so that it won't come undone. And you kind of have to tension it up, pull the rubber dam frame down a little bit, tension these up so that as you let go of the rubber dam frame, the rubber dam pushes it back up and it keeps everything under a lot of tension. And that's how we get isolation in this particular case for deep. Now, if you were doing this and you couldn't get a rubber dam on, would it matter? No, it would not. You could just do it without a rubber dam, cut the tissue, and then either put the rubber dam on after the tissue was cut, or sometimes you have to do the restoration without a rubber dam and you are just using retraction cord or Teflon or whatever to maintain a seal. So this is not the only way to do it by any means, but it is a way, and obviously a nice tidy way, but don't be afraid to cut tissue. So this case has now got the tissue fully retracted. We have the rubber dam in place, and we have ligatures holding the rubber dam out of the way, and we have a wedge. So now we're going to cut. You can notice straight away that I'm not doing my prep starting from the cavity, working my way in. I'm starting at the outline of the cavity, which we can see through the enamel as a grey shadow. There is no point leaving this overlying enamel because the shrinkage of the resin will cause it to crack and you'll get crack lines around it. You may as well cut all of this enamel off, even though it makes your heart sad. And the first thing we obviously want is clear margins. So there's no point to do anything else until the margin is clear. And it doesn't matter how deep it goes. Like if it goes deep and we're destroying the rubber dam and we have to cut the tissues and take the rubber dam off, then so be it. If you're doing it without a rubber dam and you're into the tissue and the tissue is all bleeding, too bad, you have to cut until the margin is clear. So you can see I'm going around first of all with my high speed, and all I want is where the dentine meets the enamel to be nice and clear. This is important for 2 reasons. One is because you can't bond very well to caries that's right underneath the enamel, and then secondly, it will show through the restoration if we have a lot of black dentine there. So all of this black dentine will make the filling look really grey. So we have to get rid of most of the black dentine if we can, even though we know it's probably arrested decay if it's black like that. So once I've got the enamel margin clear, now I'm going around with a slow speed burr and I'm just really getting, I want a 1 to 2 millimeter wide margin of clear dentine. And here I'm using a Comet Cera burr, which is one of these ceramic burrs. They're no better than a tungsten carbide burr, it's just they never rust, and they take like 10 years to go blunt, like they take a really long time, so you don't have to replace your burrs as often. They also look cool, but that doesn't really matter. So you can see here, I've got this whole area now cleaned out, and I'm going to cover the pulpal part of the dentine with some flowable. And the reason I'm doing this is if I start trying to sandblast or really get aggressive with any sort of cleaning or prepping or anything like this, I'm going to end up with the pulp getting exposed. Even a sandblaster will go through the dentine if the pulp is very close to the surface, a sandblast will go through that. So here I'm just doing a little bit of protection. So before I start sandblasting all the external enamel, I'm going to cover this area. And so what I've used there is first I used some Gloomer to kill off any MMPs or the proteinases that break down dentine. Then I've gone with my self-etching primer and my bond for my flowable. And now I'm just going to cover this really deep part with some flowable. Now, later on, I discovered that even though I've got all the margins super clear, this grayness was still shining through. And so I want you to see how, even though I've planned on one thing, if it's not going to work out, then we'll change our minds. So now that I've got that little bit of pulpal area completely covered, I can finish doing the bevels, and this final prep will remove any of the bond that's on the enamel surface. And then, of course, I can go around and sandblast if I need to. And at this point, I'm careful and I'm sure that the pulp is completely protected. Now, you might wonder, why am I so worried about the sandblaster blasting a hole through the last bit of dentine? Because I've done it, done everything so that you don't have to. Now we have the prep done, we've got the pulp covered, or the pulpal dentine covered with some flowable so that it is protected from air abrasion, anything else. We're not likely to kill the pulp at this point. And we wanted to get that covered as soon as possible, because the sooner you get the pulpal area or the thin dentine over the pulp covered, the more likely the tooth is to survive and have no problems. So, okay, let's get into it. So here I've now beveled the enamel, and I did that after. So you'll notice I did that pulpal covering. There was bond everywhere. I then beveled the enamel, which got most of the bond off, and then I've sandblasted the external surface of the tooth and the bit covering the pulp. It doesn't really matter, but I've sandblasted everything with no risk of damaging the pulp. I'm only worried about that if the dentine's thin. Now we're drying all of that etch off. The etch is just for the enamel, and it's just to make the enamel, make sure that we get no staining. Any sort of contamination of the enamel is one of the main causes of stain. So I like to use self-etching primer and bond, so I'm using SE Bond 2. You can see the self-etching primer there. We'll dry that off, and then we go in with the bond afterwards. I've used it for years. Super good for getting low rates of post-op sensitivity and so forth. Okay, and then we're going to thin that down. You don't really want super thick layers of bond, because if you have super thick layers of bond, that layer of unfilled resin is prone for staining. So going to cure. And now what you'll see here is I'm building up a little bit of a hip, okay? A little area where we can put a wedge against it and put a matrix. So right now the restoration is actually quite subgingival, and even though the rubber dam doesn't show, like the rubber dam is kind of hiding that, we've got a very subgingival restoration. And so if I don't put that little hip there, then when I go to put the matrix in later, there'll be nothing to hold it in place and nothing to wedge it against, because it's too subgingival. So I'm doing a centripetal buildup. That's where you do the dentine layer first, and you build it out as much as to the right size, and then you just cover the entire thing with the enamel layer. Now what's pretty quickly evident as soon as I start putting this in, and there's no matrix here yet because it's the dentine layer, is that it's grey. Okay, so you can see there, I've started putting it in, looks awful. So we don't continue, we just take it out. And it's very important to understand that this happens a lot when you're experienced. You go to do something, you go, hey, that's not working, you just quit. So now we are getting some opaque resin, and we're going to cover that dark area. So even though I put flowable on, that regular flowable won't cover the blackness. So now we're just putting some opaque resin over the top, and the opaque resin is covering that black dentine. So now you'll see when I put this dentine shade in, now it doesn't have that super grey look, because the blackness of that dentine is now covered. Okay, so now it can form like a dentine layer without looking super black or grey. And we're just going to basically make it the size of the dentine part of the tooth. So we're not making it full size. It's not covering the margins. We don't want it at the margins because it's so opaque. Once it's at the margins, it's going to show through as like a line. So we're just making sure there's space to put a whole enamel layer. This is like the centripetal buildup. If you want to do platal shells and then dentine, that's fine too. This is kind of the more simple technique for simple folk like me. So we'll cure that layer, and then we're going to need to fix the hip. So we're going to pull out that matrix, and there's going to be some roughness there because we used a wooden wedge. And now we'll get our matrix around it. So I've just put it on the mesial first because that's the tight contact. Some little, if there's bits of overhang there that are hard to manage, I don't really care. You can see we've got some blood there. Like this sort of stuff would make you freak out when you're a new dentist, because most of the time at dental school, you're not really taught that you can actually refresh the bonding. You're kind of taught that if you don't get it right the first time, that's it. You can see that I'm having a little bit of trouble getting this matrix on because I've actually got a little bit of resin that's joining the two teeth. So we've got to pick that out first, otherwise I can't get this matrix through. And then we get it through that tight mesial contact, wrap it around the tooth. There's nothing fancy here. And now I'm holding it in place. Once I got it in place, I'll use the same wedge as I had before, but now I'll be able to wedge it against that little hip. And you can see it's struggling to go through there. You may need to re-lubricate that. Okay. Now that's got a nice seal all the way around and it's got a nice pinch off against the margin. So now you might be wondering, what do we do with all the blood? Well, we're going to clean that off, wash it, give it a really good wash, really good etch, whatever we need to clean the surface off, and then we just reapply the self-etching primer, reapply the bond, and then we're ready to go for the final layer, which is the enamel. Okay, so the bit that makes this difficult is mostly dealing with this deep margin. Okay, so you can see that I've got the matrix in place. I have obviously had some blood and stuff, so I've had to wash everything off really profusely, do whatever you got to do to get rid of that blood, and now I am re-etching the surface just to clean the surface off, okay? You can't really aerobrade because it will just damage this matrix. So, and then we're going to, now that we've cleaned the surface with some etch, we're going to reapply self-etching primer and bond as if we're starting on a new tooth. Okay, it's just to make sure that the bond layer is nice and clean and refreshed so that you don't get stains because you had to do all that fiddling about between the last layer and this layer, and also you had blood and saliva and who knows what else. Totally fine to do this. When I graduated, I would have had a heart attack about getting that blood on the tooth, whereas now I just look at it and go, yeah, this happens all the time. So we're going to thin down the bond, and we're putting a little bit of flowable here. This is just like a wetting agent. I think there's a thing called modeling resin, which is like filled clear flowable, which is designed for this. If you're a poor person like me, then you're just going to use regular flowable instead of modeling resin. Much less street cred though. Your friends on Facebook won't like you as much if you don't use modeling resin. So if you're doing a lot of social media work, definitely use modeling resin. Super cool. Makes no difference really. So you can see I'm just doing the put a big blob of enamel shade on it technique. Okay, so there's no palatal. This is kind of like you just have a patient come in with a big deep cavity. You don't have time to do palatal shells and all that sort of stuff. And I think the results are very, very similar. And often similar for very deep and difficult restorations. So just making sure I've got enough. It's over bulked, but I really need to make sure that I have enough there. I don't want to find out that I'm short because it's harder to fix that than to fix too much. If you've got too much bulk, easy to cut back. If you don't have enough bulk, very hard to fix. So here I have the resin on. I'm just putting a little bit more on the buccal there. I think I hadn't covered the bevel enough, and that's really like the worst thing that you can do is you finish the restoration and you realize that you hadn't quite covered the enamel bevel enough, and then you've got to start the whole thing again, and that's a recipe for sadness. Now that we have the bulk done, we just cure it, and now we've got to do massive, very rapid bulk reduction to the right shape. Okay, so first of all, we want to find the margin, so we're going to just use a coarse disc. And what you don't realize when you watch other people do stuff, or particularly when they take photos, is how many coarse discs they're using. So I use almost no other disc except the coarse one, so I never use medium fine or super fine, not since dental school. But I use like 1 million coarse discs. In fact, 1 million coarse discs. So here, now obviously it's a little bit hard to do around the gingival margin because the ligatures are in the way, and it is, just destroy those ligatures, don't worry about them, and you can go back and do more polishing at this area, but it's super important to get your edges smooth. Like a join margin or something going over onto the enamel beyond where you've etched will cause staining, and having any sort of roughness at the margin will cause staining as well. So now we're just doing bulk, so getting the face flat, and you don't want to try and make it look like a tooth yet, you just want to get the right contours. So you can see now I've got overhangs there, and how do I get the overhangs off? I just use a scalpel. So it really doesn't matter, like if you cause an overhang, you can easily get rid of them. You just use a scalpel and you can shave them off. Takes like 1 minute. Yes, it makes the tissues bleed. It's not your tissue anyway. Patient will get over it. Okay, And now we get in there, and you can see I put my lines in there, kind of like my plane. So there's like the mesial and distal plane, and then you've got the two facial planes, which combine to give a canine shape. And with teeth, they're generally like flat with round corners. They are not round. So if you make it round and then polish it, it'll just look like crap, okay? It will look super undistinguished. It'll just look awful. So make it quite, particularly with composite resin, you have to make the tooth kind of the right shape, but chunky. And then once the tooth is the correct shape, then you polish it, and the polishing will round all of the corners. Now you can see here that I am now got a football burr in. I'm just taking all the bulk off. Don't bother trying to check the occlusion until the palette resin is flush with the enamel on one side of the cavity and the same height as the contact points on the adjacent tooth. So if you can see the adjacent marginal ridge is this height, don't have the filling like this height. You know that you're going to have them the same height. So you might as well just trim the restoration until it's the same height as the adjacent marginal ridge or palatal surface. Just cut it back. It'll still be too high, but now at least it won't be way too high. It'll just be a little bit too high. Your number 12 scalpel is your friend. Okay, you can get rid of any overhang with it on the anterior teeth and most posterior teeth. The key with embrasures, they go really deep between the teeth. It's actually hard. Sometimes you need to, you can see here I'm using a burr to try and get that palatal or that gingival margin nice and smooth. Re-curing it, because when I cured it the first time, it was not cured enough in this area. So, and then trying to get those nice planes in place and a nice deep embrasures. If you look at the adjacent teeth, you can see embrasures go a long way in between the teeth, like nearly halfway through. The contact point is nearly halfway through the teeth. Now, at this point, take off your ligatures first. Everyone who does this will at one point leave a ligature in the tissue and the patient will come back and then there'll be massive inflammation and it's because you left the ligatures in. So always remove them first before the rubber dam. After you take the rubber dam on, the ligatures disappear under the gum and they're really hard to get out. So always take them off first. And now we're ready for polishing. So now we've done all of this, we've taken the rubber dam off and we're going to pull. There's always that one little bit of sneaky rubber dam that tears and it's stuck in there. And we want to pull that out. So do whatever you got to do that, but just don't leave it there. Okay, and you always want to get some air and really blow hard in between to make sure that the area is nice and clean. So next, I'm smoothing the gingival margin. Okay, so a lot of times we think that the gingival margin must be smooth from the matrix. It does not. Okay, you can have a massive overhang, you can still make it smooth. I mean, all those injection molding cases people do, they end up with massive overhangs and they make them smooth. So here, now, before we bother making it smooth and pretty, we just want to make this bite good, because if we leave the bite high, 1, the restoration will break, 2, the patient will be unhappy, and 3, it will possibly get sore. Don't be a chicken when you are doing occlusal reduction, because what will happen is you'll sit there and go, do like the most delicate little ballerina adjustments, and then you'll just be there for an hour. So look at how high the teeth are apart. So if they're like 1/2 mil, just grind 1/2 mil off, okay? That's half of a real millimeter, not a dental millimeter. Dental millimeters, there's like 10 of them to an actual millimeter. So if you ask a dentist to cut a millimeter off, they just like take 3 microns and then they go, is that enough? And they go, no, take a whole millimeter off. So just grind it back. If it's slightly low, the patient will live, the tooth will erupt into position. If it's high, it's going to cause lots of problems. In fact, occlusal loading is the main reason that resins snap. So here we adjust all of this, and basically there's no point going on until this is perfect. Okay, it has to be, and you don't want light occlusion with carbon paper on a resin. You want no occlusion on the resin and all the occlusion on the tooth. It will move anyway over time, but you want it to start that way. And you can see here, I got to go and go and go. And what happens is people give up. They go, I'm tired of this and I don't want to do any more adjustment and I want to go home. And then, of course, the patient is going to call you the next day and you'll be fully booked and you'll still have to see them. So you may as well just do it now. If it's taking too long, then obviously get a new burr, because sometimes our finishing burrs get blunt and they take too long. Now I'm being absolutely certain that there's smoothness. You can check it with floss. You can check it by blowing air in there so that you retract the tissues with the air and you can see it. You can do it by checking with your probe. I don't really care if it bleeds or if you traumatize the tissue at this point. It must be smooth, otherwise the tissue will be traumatized forever. Okay, and then you can see I'm flossing to just check any little areas around that are smooth. And you'll notice I got this kind of methodical thing where I first got the occlusion right, then I'm getting all of the gingival margin right. I'm not bothering with the aesthetics until that's done, and doing the buccal, lingual, everywhere, and now I'm doing the shapes. Okay, so I want to get this embrasure nice and deep because that's what makes the tooth look like a tooth, and getting the shape of the incisal edge right as well. As you can see, mostly getting this done with the coarse disc, and then once again putting our lines in. The line's just a guideline because you can kind of easily lose your bearings. And now you can see I've got this super fine burr. It's just a very, very narrow tipped diamond burr, good for getting into proximal. You can't hit the tooth next door with it, so there'll be a little fine lip that we need to use the scalpel to smooth over, okay? And here in this case, I want to put a little bit of texture on and a little bit of a dent in there. I'm just going to use a rubber point or a stone to do that because it generally will do it with less scratching. If that's too slow, then we can use a burr, but burrs tend to leave scratches that are too heavy. So you end up with the scratches being like not natural like the pericomata. They tend to be too like someone got a burr and put fake scratches in it, which they did, but it doesn't look like nature. So we want to soften those out. And if we want a lot of scratches, we'll do that later with a slow speed burr. So generally getting it smoothed up. And the reason we want such chunky corners, so the reason we want to make it with like square corners is because as we polish it, it will get rounder. With ceramics, completely different. So don't do this with ceramics. With ceramics, because they're so hard, you need to have it rounded before you start glazing. Now I'm just going to do a light polish because I want to be able to see the surface. And now I'm putting a bit more texture in. So the texture is coming from basically just using a burr. This is a slow speed diamond burr, and I'm just using it very slowly to put texture in. You can see I'm using both the side of it as well as the tip. The tip is running backwards and forwards. It's allowing us to get some very faint texture there that doesn't look like burrs. Okay, and now we polish. And the thing with polishing, when you want to try and keep the texture there, what you need to do is you normally go through a sequence of polishes. You start with the one that gets it like super medium fine, and then you go to the one that gets super fine. When you're trying to keep the texture, you need to go from the medium fine to the fine polisher very quickly because you need to leave some texture on there and then just make it shiny. So in this case, we are just getting the leaving a little bit of texture there from that diamond burr, and then going a little bit with the medium polisher just to take the edge off things, and then we're going to the super fine polisher before we've fully removed all of that texture and we make all of that texture shiny. That's a key thing. If you're not trying to keep texture and you want it dead smooth, then you just get medium polisher until it's super smooth as you can get it with this medium polisher, and then you move on to the fine polisher and you make that as smooth as you can. We also spend quite a lot of time on the palate side. A lot of times people forget to polish the palate side and the patient won't see it, okay? But a lot of times dentists leave the palate side really bad and the patient will just feel it and go, it feels really rough. And they'll just think it will just put a bad feeling on how good the quality of the work is. So there you go, that's how I finish a composite restoration where I'm trying to get a little bit of texture. Now with the video, you can't really see the texture because I haven't used side lights, but that texture was nice and subtle on the tooth. Thanks for watching, bye.